Have you ever diagnosed yourself? Have you ever been a doctor of your own? Have you ever taken a wrong medication prescribed by your own self? Or have you taken a wrong medication prescribed by any physician? Today's program is for you. It's Health Check, the program, one of the most cherished by you, our viewers. And the topic of discussion today is incorrect diagnosis and dosage. With me in the studio today is Dr. Becca Akaturinda to help us take us through and understand the topic of discussion today. You're most welcome, Doctor.
Thank you, sir.
And I promise you, today's program is more spiced because I have one of the doctors that has not managed to be with us today. He's at his working place. He will join us later on in the program because he's following. That is Dr. Mwanika Abdul Hakim. And just like I told you, it is more spiced. We'll have to join you, our viewers out there, since the advice that the doctors bring here is for you. So we'll join you wherever you are to give us your view as the program proceeds. Dr. Becca.
Yes, sir.
We as Africans have a problem.
Sure.
We tend not to spend money for diagnosis, thinking that is expensive. So we become our own doctors. Okay?
True.
So I want you to let us know why and how do people go about or down to this incorrect diagnosis and self-medication or dosage.
Yeah, thank you, moderator. This is very common and it's usual almost everywhere. People think that when they go to hospital and they charge the consultation fee, it is a wastage of money. When they feel any symptom or sign, they diagnose themselves.
Yes.
And prescribe for themselves the medicines. So just send a child to the pharmacy and say, get for me this and this and this, me I will be fine. So they end up having incorrect diagnosis by themselves and incorrect dosaging.
Okay.
That's common. Some of them can go to hospital and are given, and the mistake happens and they're diagnosed incorrectly. But in most cases, it is the patients themselves who diagnose themselves wrongly and give themselves a wrong dosage.
Thanks a lot, Dr. Becca Katurinda. This now brings me to my brother, Dr. Mkwanga Abdul Hakim. Do you have any facts, Dr. Mkwanga, regarding the topic of discussion today? Do you have any facts, Dr. Mkwanga?
Thank you so much, our dear host, for this program. And I thank so much our dear viewers who have given us this opportunity to pass on this information to you. To my fellow doctor in the studios, Dr. Becca Akaturinda, thank you so much for passing on this information to our dear viewers. And I'll go straight away to the question posed to me about improper diagnosis and the facts about improper diagnosis. Basically, I'll start with, diagnosis is basically finding out the particular illness that a patient is experiencing and trying to provide the appropriate treatment to that particular illness. So with proper diagnosis, we look at quite a number of quality aims that generally characterize what proper diagnosis is supposed to be. One of these is that proper diagnosis is supposed to be safe. That is, it is supposed to avoid any injuries to the patient and try to deliver the intended use of that diagnosis to the patient. Number two, proper diagnosis is supposed to be effective. That is providing services based on scientific knowledge to all who could benefit and refraining from providing services to those not likely to benefit. Proper diagnosis is supposed to be patient-centered, thereby, looking at all those things that are supposed to benefit the patient and providing those to the patient. Another thing is that proper diagnosis is supposed to be timely, or what we call within the turnaround time prescribed for that particular diagnosis. If, for example, me as a medical laboratory technologist, I'm supposed to do a diagnosis on let's say, diabetes, I get a sample that is for glucose. I'm supposed to release that particular result in the allocated time possible. Let's say if I release the result within a TAT or a turnaround time of 1 hour, it is supposed to affect the channels that the doctor is going to take through, or is supposed to go through to provide the proper diagnosis to the patient. So I'm not supposed to take so long and not so short to provide improper diagnosis. And then proper diagnosis is supposed to be effective, efficient, in that it is supposed to avoid wastage, including wastage of equipment, supplies, and human resource. And lastly, it's supposed to be equitable. That is, you're supposed to provide it in an equal manner to all who come to access that particular service. And therefore, from all these aims of quality, of proper diagnosis, we come to what we call diagnostic error or improper diagnosis. And to me, I borrow a leaf from the IOM, that is the Institute of Medicine, which defines an error in medicine or an error in diagnosis as the failure to establish an accurate and timely explanation of the patient's health problems or communicate that explanation to the patient. Ideally, what I'm trying to pass on to our dear viewers is that if a given institute does not correctly identify the illness that a patient is having, or poorly diagnoses what the patient has, and in so doing, the patient doesn't achieve the required explanation or the required concept of what is happening to them, that is what we term as improper diagnosis. And there are quite a number of standards to help us in our different countries. And in Uganda, we have what we call the Uganda Medical and Dental Practitioners Council. This is a council that is there to establish the correctiveness and the accreditation of different health facilities and the different doctors who work in these health facilities. And also the different dental practitioners who work in the different dental facilities. These councils are basically put in place to regulate the quality of the health professionals and also the quality of the clinics and healthcare providers. In the UK, I know of the General Medical Council, that is GMC, and all those doctors who normally visit Uganda normally go through this General Medical Council to get certification of their qualifications and to make them quality health professionals, so that we know that whatever services are going to be provided by these different medical professionals is quality. So I call upon our dear viewers to always take keen interest in identifying whether a health facility or a health care provider is actually certified or accredited by the different accreditation bodies in their different countries. And for us who are the medical laboratory technologists, we have our health council is called Allied Health Practitioners Council here in Uganda, and it is the one that gives different licenses and certificates to the laboratory practitioners. With this, I think our dear viewers can take a view of what health diagnosis and proper diagnosis is supposed to be, and what improper diagnosis entails. Thank you so much, host. I'll pass it on to you again.
Oh, thanks a lot, Dr. Abdul Hakim. Dr. Baker Katulinde,
Yes,
you've heard him.
Yeah, sure.
He has shown us the improper and proper diagnosis methods.
Yeah.
Yes. Do you have any submission?
any disease has its own treatment. I will definitely not forget to tell people who just say, me, Panadol will work for me. Any disease, Panadol. Any disease, because that's what they know.
Yes.
Headache, Panadol. Fever, Panadol. Stomach pain, Panadol. Anything, Panadol. So that is really a challenge. It's a big problem. So this incorrect diagnosis and dosaging comes up when people usually have self-medication.
Okay.
We discourage it so much as we can.
Thank you so much, Dr. Baker Akaturinda. Now I turn to you, our viewer, like I had promised you, that we'll have to get views from you. Let's see where our cameras landed exactly in Kampala, and let's see who the cameras captured. We need to know what they need our health team to help us with. We are to you, our viewers.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Kutu Muhammad. I have a question I would like to ask. Can a family request an autopsy? What happens if you continue experiencing the symptoms? What does the doctor say about this?
Yeah, that is Mehdi.
Yes, very important.
But before you go to that question,
Yes.
that reminds me of the causes, and after the causes, then we go to the symptoms.
True.
Yes, let's go to the causes of this incorrect diagnosis and self-medication.
Then you shall go to his question as we move around.
Yes.
Good. Thank you. Now, improper diagnosis and treatment, here in Africa, the biggest cause, especially on the side of patients, is self-medication. It is the biggest challenge we have, I think, in Africa, where people, like I said, think that consultation fee in hospital is expensive.
Yes.
Is actually a wastage of money. So they feel what they are feeding as patients and send a child, a pharmacy, out to buy some medicine for themselves. So that it definitely leads to incorrect diagnosis and treatment. Another challenge is lack of caretakers. This comes in cases where we're in hospital and the doctor gives a right diagnosis, then he gives treatment. But because the person is sick, may forget to take it or fails to take it.
Yes.
Now, if there is a caretaker, he can help to give the right dosage. However much he would have gotten right diagnosis, but the dosage, he may get wrong one because nobody there to give and remind you, take now, take this time, take now.
Yes, yes.
That's also a challenge. Another challenge is failure to understand instructions well. I'll give you a simple example. When they give you Panadol and they say 2 times 3, and before you take 3 times 2, that will be wrong.
Or you take 2 times 3 in mathematics, that is 6.
6, so you take 6 at once.
Of them.
Yes, you say, the headache is too much, let me take at once and I get healed.
Yes.
So you take 6 at once. That is very dangerous. That is an incorrect dosage. Because you didn't understand the instructions very well, given by a doctor. So that is a challenge that even when you have gotten the right diagnosis, but the dosage you get the wrong one.
Yes.
Because you not understood the instructions. Another challenge is there are some conditions and there are some diseases which naturally make patients forget. This is called dementia. Dementia is the challenge, a disease where a person has forgetfulness.
Okay.
So you tell him to take 2 times 3, he takes in the morning, during the day forgets, then remembers at night. So in that case, a person will have an incorrect diagnosis. Sorry, will have a correct diagnosis, but a long dosaging.
Yes.
That's a very serious issue. There's another issue I want to talk about also. Large number of patients to doctors. Like you are one doctor, you are seeing 100 patients. So you don't have enough time to take on a patient to find out how the patient is feeling.
Yes.
In this case, it's common in Africa where the patient-doctor ratio is high. The doctors are very few,
Yes.
patients
The
are very many.
Very many.
So there's no enough time to take keen interest into finding out what exactly is this person suffering from. There there's not enough time, money, power for a doctor to find out exactly what this person is feeling exactly. So in the long run, he will just think has this, right, for the medication, so gets a wrong diagnosis and an incorrect dosaging. Okay. Another big challenge you have in Africa here is lack of facilities. Dr. Mukwanga, thank you so much. He mentioned about it, talked about investigating the cause, the diagnosis of the patient. Now here in Africa, I'm sorry to say, you find a hospital, there's no laboratory. Or it is there with no equipment.
Yes.
You, the doctor, you want to request some investigations, but they are not there.
There are no equipments.
No equipments to use, yes. So you will get in a stage where you are now doing guesswork. You say, I think the person suffers from a liver disease, because you have no scan of the abdomen to do, to find out. You say, I think this person has fibroids, but you haven't done the scan to find out, because there's no scan services. So it is a very big challenge. It's one of the cause of this incorrect diagnosis and dosage. Another issue I can't forget, which is the common issue here in Africa, poverty. Poverty.
Okay.
Lack of money.
How is it a cause now?
It is a serious cause in that you, the doctor, you will be knowing what to do to investigate the cause of this disease. You write for the patient to go and do this and this and this, but the things are costing 100,000. The patient came with 1,000. So it becomes a challenge.
And that 1,000 after selling some of his...
Exactly. Maybe he sold his chicken has only 30. 10,000 is for transport. 20 is what she wants you to use for treatment.
Yes.
Now, even if by chance that hospital has the required equipment, but the charges will be too hard for the patient. So you end up missing the correct diagnosis. And even when you're giving the medication, because the patient has no money to buy the drugs, he will take an incorrect dosage. Okay. So that's a serious issue here, which in Africa we can't forget to mention.
Incorrect diagnosis and dosage is a complicated issue.
Sure.
That brings me to the complications that comes with it.
Sure, surely.
If there is any.
They are there. Definitely anything negative has negative effects.
Okay.
We can't, and most of the cases we discuss here on Health Check, most of them have serious complications. Dear viewer, you must be knowing, you must be aware that anything you do wrongly, it will lead to a serious complication. And like I always say, prevention is cheaper, cure is expensive. Now, when you prevent this incorrect diagnosis and dosage, you'll be saving yourself from spending much money in the complications. One of the complications is lack of improvement. You are having headache, you take an incorrect dosage of Panadol, headache goes away for a short time, then it comes back.
Okay.
Then the Panadol will no longer work for you. Now you spend more money to buy an expensive medicine. So it is a serious issue of not getting relief of the symptoms. So they persevere, they persist. Another serious complication is, we call it in medical terms, adverse effects. In simple term, we call it side effects. When you are taking incorrect dosaging of the medication, you have adverse effects or side effects than what we expected. I'll give you a simple example. We talked about taking, when they say take 2 times 3, then you say 2 times 3 equals 6, then you take 6 at once. Mathematically, you take 6 at once. It is a serious issue. You can even die. It's possible when you take much medicines. Overdose, that's overdose. It's a serious issue. Then there is an issue I can't fail to talk about. It is called drug resistance. And that's a serious issue in Africa here, because patients have taken drugs by themselves, by the way, self-medication, over and over, and taking less doses. Now what happens is, the pathogen, let me give a simple example, like bacteria, is not completely killed, because they are taking half dose. And now that pathogen is getting used to this medicine. It means even when you get a correct dose, it won't go away. That's what we call drug resistance. So time reaches when the medicine which should actually work for you no longer works.
No longer
because
works
you took
because
half
of-
doses, half doses, half doses. So the pathogen got used to this medication. It developed a strong skin against this medication. I may not go into details, but when you give a medicine, it goes and attacks the skin of the pathogen, say bacteria, and enters it and kills it. Now, because you have been giving it small doses, you tamper with it but don't kill it, it itself develops a thick skin to prevent this medication.
Okay.
So when you take it, even if correct doses, you won't get fine. So that is called drug resistance,
Okay.
a very serious complication of incorrect diagnosis and incorrect dosaging.
Okay.
There is another issue I cannot forget to talk about: unnecessary drugs or
Unnecessary drugs.
unnecessary expenditure. When you go to hospital, ideally you're supposed to go to say a doctor. He examines you, tell him how you are feeling. He requests for some laboratory checkups, and they find out what exactly you are suffering from. Then he will know, oh, it's only malaria. He gives you the treatment specifically
For malaria.
for malaria or for that disease which you'll be suffering from. Now, imagine you feel headache, stomach pain, leg pain. Then for you get medication for the head, for the stomach, for the legs. So you get excessive medicines which may not be necessary. So you're actually spending much when you don't know. So unnecessary expenditure, unnecessary treatment, drugs
Okay.
is a serious complication of this incorrect diagnosis.
Thank you so much, Dr.
Yes.
Baker Katurinda. I hope our viewers are following.
Sure.
Dr. Baker,
Yes.
this now brings me to a question that I hope our viewer is having in their minds.
True.
How do you tell that such and such a person had a wrong dosage?
Exactly. That's why the viewer was asking, can a family request for an autopsy?
Yes.
An autopsy.
So I'm now asking for symptoms
Sure.
of incorrect diagnosis.
Sure. The symptoms of this incorrect diagnosis, the first one is worsening symptoms.
Worsening symptoms.
Yes. Ideally, when you have a correct diagnosis and a correct dosage, you are supposed to get relief of the symptoms and the signs you are having. But now, because you are taking an incorrect diagnosis with incorrect medicines, the disease won't go away. You'll keep suffering from this disease, you keep having the challenge, and you'll wonder what's happening. So it's a serious issue that you will have worsening symptoms. They will not go away, they will keep there. Another issue I can talk about, you can have pain.
Pain.
Yes. Because the disease is not solved, so you keep having the pain. So that should make you think that either I got a wrong diagnosis or I'm taking a wrong dosage of the treatment.
Okay.
So in that case, what you do, you rush back to hospital and they do more checkup to establish the correct diagnosis, so that you get the correct dosage and you become fine. At least 3 days before you finish the dose, you should see some improvement.
Some improvement.
But now you are exactly the same way you began. Then it means something is wrong. Because if it is a bacteria and you're giving an antibiotic specifically for it, it's supposed to reach and crush it, you get some relief. Then you continue and finish.
Okay.
But if you see nothing is changing, then it calls for a re-evaluation of the diagnosis.
Okay.
Yes.
Having seen or understood the symptoms, now this takes me to the question that our brother asked. He wanted to know, can a family request an autopsy? And the second question was, what happens if you continue to experience the same symptoms?
Exactly. One, autopsy, most people know it as, it is the test we do after the person has passed on. So it is called post-mortem.
Okay.
So it is very important for a family to do. I will give an answer and say, yes, a family can ask for an autopsy if they want to establish the cause of the death of their person who has passed on. It's very important for any family or anybody who passes on with okay, whose death is questionable, to do an autopsy and find out why this person has passed on, the rate or the stage of the disease where the person has passed on, to which part of the person, of the body, we are severely affected. It is very, very important. He also went ahead and asked if what the person should do if he continues to face symptoms. In my explanation, I said it is very important, if you don't see an improvement, to go back to hospital for re-evaluation. True, the doctor might have evaluated you and given you treatment. He might have done a test and found out that you have malaria, maybe. But if you are not improving, we encourage that you go back and they do more tests to find out what exactly is the problem. Now, we talked about self-medication. Now, if you did self-medication,
Okay.
if you had become your own doctor, then you advise that you go back to you go to hospital now, seek advice from a medical person, a medical doctor. Let him be your doctor this time.
Okay.
He will do the needful.
So get an external doctor.
Exactly. If you are having a doctor, you can get an external doctor or another doctor for another second opinion. But if you have been your own doctor, you just said, I have malaria, I think. You got treatment. This time you have to go to a doctor and ask, doctor, I thought I have malaria, so I took this and this. But I'm seeing no change. What can I do? Then he will request for some investigations, he will investigate some tests, then he will get the correct diagnosis.
That's the same question I have right now, doctor.
Yes.
Prevention is better than cure.
Sure.
Yes, prevention is cheaper, but unfortunately, I didn't understand that. Unfortunately, it came too late. Is there any treatment for the incorrect diagnosis and dosage?
Yes. Anything is having treatment. Any problem which comes, it has a solution.
It's too late. I've become my own doctor for quite some good time.
Yes.
Symptoms persisted. Can I get rid of the ailments?
Yeah, surely you
Later
can.
on.
You can. Like we talked, like we said, this incorrect dosage and diagnosis and dosage will lead to serious complications and problems. So if, unfortunately, you have treated yourself incorrectly and given yourself a wrong dosage, it is very important now that we can manage. One, we shall treat the symptoms, or we shall treat the complications which will have come from that self-diagnosis. A simple example, if you thought you had malaria and you didn't have, and you took many medicines and you spread it to your liver, now we shall go in and treat the liver, which has gotten a complication. Assuming you took the medicines and didn't get fine, now we shall investigate, find the real cause, and treat you appropriately. So here the treatment is we treat the problem which you have caused by yourself. So here it's simple that you go to hospital, explain and be open.
I remain your host, Namba Ali Bashir, and until we meet in the next episode, inshallah, assalamu alaikum wa rahmatullahi wa barakatuh.